Hello all, I am Anne Maria Alex, Assistant Professor, Department of Pharmacognosy. Today we are going to deal with Chinese System of Medicine, which comes in the fourth unit of Pharmacognosy and Phytochemistry 1 of fourth semester. As you know, in the fourth unit we have two set of topics. The first one is Indian System of Medicine and the second set of topics include Introduction to Secondary Metabolites. In the Indian system of medicine, we have Ayurveda, Siddha, Unani, Chinese system of medicine, yoga and naturopathy. So we can see a contradiction here as we use the term Indian system of medicine. Indian system of medicine usually refers to those systems in which herbs are used as the major drugs. Basically, in Indian system of medicine, we have Ayurveda and Siddha, which originated in India, while Unani originated in Persia. And coming to Chinese system of medicine, you know where it may have been originated. It's in China. So, Chinese system of medicine, also known as traditional Chinese medicine, is an ancient healing system and it dates back to 2000 plus years, that is BC era. And coming to the core text of Chinese system of medicine, it is Huan Dine Jing. You may excuse my pronunciation as I am not so fluent in Chinese. There may be issues with my pronunciations. Kindly excuse that. And coming to the therapies involved in Chinese system of medicine, acupuncture, dietary therapy, as well as we have pharmacotherapy. Coming to the units we'll be dealing in Chinese system of medicine, we'll be going through the history and the origin, and the next will be the theories, that is yin and yang theory as well as the theory of five elements. We'll be going in detail with the concept of Qi or life force and the meridians. And the next will be the diagnosis used in traditional Chinese medicine. What are the treatment modalities, which include around 12 modalities. And we'll be also going through a four set of medicines or herbs which are used in Chinese system, as well as there is an adaptation of Chinese system of medicine which is used in Japan, which is known as Kempo. We'll just go through a glimpse, and again what are the safety perspectives of traditional system or Chinese system of medicine. These are the topics which are included inside Chinese system of medicine. Now coming to the history or ancient origins, as I already said, Chinese system of medicine dates back to BC era. So in BC era, the first traces of Chinese system of medicine was reported under Shang dynasty, which dates back to 1600 to 1100 BC. In the Shang dynasty or under Shang dynasty, we can say the inscriptions or the scripts for treatments were written on bones of oxes or oracles or on tortoise shells. Okay. Now coming to the next dynasty, it was Zhou dynasty. In Zhou dynasty dates back to 1046 to 256 BC. Zhou dynasty made the foundation of yin and yang as well as the five elements as well as the meridian theory. So the foundation of yin yang, five elements and meridian theory was established under Zhou dynasty. Now coming to the next dynasty or the next major milestone, it is Huan Dine Jing, which is often referred to as the Bible of Chinese system of medicine. It is also known as the Yellow Emperor's Classic, and it compiles pathology, physiology, as well as the treatment which is used in Chinese system of medicine. So you can see the dates 200 BCE to 100 AD. So that is from before Christ, we have shifted to Anno Domini or after Christ. So in this comes the Shenong Bencao Jing, which is comes a written pharmacopoeia in which the uses of herbs as well as what are the natural remedies are being dictated. It is under the Han dynasty which led to the written pharmacopoeia, which is Shenron Benkao Jing. Next in CE comes Tang dynasty. Tang dynasty set the first school of medicine or the first school of herbal medicine in China, and Sun Simiao, the king of herbal medicine, established the first school of herbal medicine. And the last one is the Compendium of Materia Medica. Materia Medica is a compilation of 11,000 plus prescriptions, as well as we have 1,892 drugs, out of which 1,094 are herbs. So Li Shizhen compiled Materia Medica. So this is a glimpse of the history or the origin of Chinese system of medicine. Now let's go to the principles of Chinese system of medicine. So as I have already mentioned, we have two types of concepts which formed during the Zhou dynasty, which is foundation of yin yang as well as 5 elements. So a person who already knows Indian system of medicine such as Ayurveda, Siddha knows the concept of 5 elements. In Ayurveda and Siddha, we say the whole body is composed of 5 natural elements. In Chinese system of medicine also, we say that the body is in alignment, or the human body is in alignment with the natural law or Taoism, where the body follows the natural rules. So the foundation of yin yang is similar to that of Shiva Shakti concept of Siddha system of medicine. So yin yang can be also termed as feminine or masculine side of energy. So you can see a comparison of yin yang. So what comes under yin is the shady side of a hill, whereas yang is the sunny side of a hill. So this is a philosophical concept or a Chinese philosophy. Imagine a hill. So a hill will be having two kind of areas. One will be the area where the sunlight directly hits, and the other will be the shade of the hill. So the shade of the hill is termed as yin, while the sunny side or where the light hits is termed as yang. So what are the features of yin and yang? In yin, we have, it is as I already explained, a darker side. It is a passive side or a rustic side, because compare it with the concept, we are talking about the colder area or the shady area of a hill. So there will be less action. So that's why we have passive or passive energy. And coming to the cold, because it is in the shade, we have a cold area, and it can be referred to as the moon, and it can be referred to as that of earth. It can be referred to as a feminine and interior. So basically, these terms describe the yin energy, whereas light, active, hot or fire, sun, heaven, male or exterior describes the yang energy. One thing which you people should note here is that this is a philosophy. It doesn't mean that the yin energy is a bad energy or the yang energy is a light energy. This simply means that energy has two types of forms, that is yin as well as yang, or dark as well as light, passive or active, rest or motion, cold or hot, water or fire. So just see the concepts or just see the words which is used to describe the yin and yang energy. Both are complementary. One cannot exist without the other. We cannot appreciate light without darkness. So that for appreciating light, we need darkness. So I hope yin yang theory is understandable or it is clear. Now coming to the balance. So according to the yin yang theory, each human body is composed of both yin as well as yang. So a body is said to be healthy if there is a balance between the yin energy as well as the yang energy. I hope you people find it similar with that of the Siddha system of medicine, where we describe the Shiva as well as the Shakti, that is masculine and feminine form of energy. So yin and yang theory is also comparable to that of Shiva Shakti theory of Siddha system of medicine. So likewise, yin yang balance leads to the equilibrium or the healthy system, or the system where the body is in the most balanced condition. We may also say that any imbalance or any deficiency or excess of yin or yang can lead to disease conditions. And again, any imbalance in the yin or yang can lead to the obstruction of qi, the life force. That is the next concept of traditional Chinese medicine or Chinese system of medicine. So once again, I'll just explain. Yin and yang are complementary energies which is inside the human body. As a philosophy, it's not that literally it is inside the human body. In the Chinese system of medicine or traditional Chinese medicine, we say each human body is composed of yin and yang. Both are complementary forces, not opposing forces. Any imbalance in the yin-yang equilibrium can lead to disease, which happens due to the obstruction of qi or the life force. Now coming to the qi. So 5 elements which I already explained initially, or I just gave an introduction. 5 elements of Chinese system of medicine is a continuous cycle. If you have already dealt with Ayurveda and Siddha, you may know that each human body or each living organism is composed of 5 elements. That is water, air, fire, earth and sky. But in Ayurveda and Siddha system of medicine, these have a balance or an equilibrium, but they don't have a continuous process or a continuous cycle. But in Chinese system of medicine or traditional system of medicine, we can say that this is a continuous cycle. So now you may see the order. So wood generates fire. You people know. So if we keep together or if we rub together 2 dried woods, it generates fire, right? So wood generates fire. Coming to the next element, fire creates earth. So once the wood finishes its burning, what is left? Left is ash. Ash can be termed as earthy material, right? Okay. So coming to the next element, earth gives metal. So where do metals come from? Metals come from ore, right? Ore is the starting material, O-R-E. Ores are the starting material of metals which are mined from the earth, right? So earth generates metal. And coming to the water, metal obstructs water. As you know, how is water condensed of? It's condensed of metals. That's why water generates from metal. And coming to the next one is water give rise to or it nourishes wood. I hope the concept is clear. The five elements theory of traditional Chinese system, we have a continuous cycle: wood, fire, earth, metal and water. Now for each element we have an organ as well as a season as well as an emotion. Okay, this is a deeper side. So for wood we have the organ liver and the season is spring and the emotion attached is anchor. Coming to the fire, the organ is intestines and season is summer and emotion is joy. So the concept of season correlates with the time at which these elements aggravate in the human body, which may lead to diseases. That is the importance of season. And emotion comes from the concept that everything happening in the human body is not as a result of physiological processes. Chinese system of medicine gives credits to psychological issues also. That is, some psychological issues can lead to physiological issues in the body. You may have heard that if you have some kind of um, unvoiced issues inside you, for example, if you have suppressed your voice or if you have not expressed your thoughts, you may generate a pain or an or a pain like sensation in neck, I mean the neck area. So that is a concept which comes from this traditional Chinese medicine, where they say that psychological issues or psychological emotions or the emotions which we suppress can lead to issues in various organs or the human body. Coming to the earth, we have the organ as stomach or spleen, and the season is late summer, where the emotion is worry. So you people will be already knowing that if you people are worried, you get stomach pain, isn't it? It's a common symptom. Coming to the metal, the organ is lung or again large intestine, and the emotion is grief as well as season is autumn. Coming to water, organ is kidney or bladder, season is winter, and the emotion is fear. Okay, so you may also have noticed that for some people, when we feel fear, we feel like urinating. That is the correlation here. So I hope the five elements theory is clear for you people. Now coming to the ki or the life force. So ki is the life force or the energy that flows through the body through channels called meridians. We have 12 meridian pairs, and these channels, these are the linkage between the organs, and any obstruction in the life force or ki can lead to disease conditions. So what are the causes of ki now? The causes of ki include the emotional disturbances, poor diet and lifestyle habits, external pathogens, and trauma or overwork or constitutional factors. So these four sets are the causes of ki imbalance. And the life force or the ki is supposedly moving the blood through the tissues or the vessels, and the blood nourishes the organs that produce ki. So both ki as well as blood, they work together. And coming to the yin and yang, these are the body fluids somewhat similar to that of lymphs. We know the lymphatic system, right? Lymphatic system. So the yin as well as yang are the fluids that are found in between the joints that moisten the sensory organs, and they are responsible for the movement. Now coming to the meridians or the channels through which the ki runs through the body. So coming to the channels, we have lung, large intestine, stomach, spleen, heart, small intestines, bladder, kidney, pericardium, triple burner, gallbladder, and liver. These are not uh, to be emphasized as such because it gives a larger quantity. Uh, but still, as we say, key meridians also are important for. Coming to the diagnosis systems in TCM, we have four set of examinations. First one is the inspection, second one is auscultation and olfaction, third one is inquiry, and fourth one is the palpation. So these are similar to that of our alternate system of medicine or the English system of medicine where we inspect. So once we go to a doctor, what do doctors do? They observe the patients first, right? They look for they'll for coming to the Indian system of medicine, they may check in the eyes as well as tongue. If we have some cold or fever, they check the tongue as well as they check the pulses, right? These are the primary inspections done by a English doctor. While coming to the traditional system of medicine, what are the inspections which a Chinese doctor does? A Chinese doctor, he looks for, or a doctor who follows Chinese system of medicine, he looks for face color as well as complexion. And coming to the shape or the coating of our tongue, what is the color of the tongue that is being observed. And coming to the eyes, lips, nails, skin, body posture, and how bright are the eyes of the person. So this is supposedly to be a um, individual system. Individual system as in each doctor may diagnose you differently in holistic system of medicine because it is completely the jurisdiction or completely the doctor's opinion, like each person describe a patient differently or each person or each doctor describes the person's conditions according to the doctor's qualitative analysis, right? So inspection can differ according to the doctor. Now the second one is auscultation and olfaction. In auscultation, what they check for is the quality or strength of the voice, how the patient breathes, how frequently or what is the nature of the cough. You know, while you have a dry cough or a wet cough, we cough differently. And what is the body odor or what is the mouth odor which comes out of that person. These things are examined in auscultation and olfaction. Now coming to the inquiry. In inquiry, the doctor asks for the patient's chief complaint. What is the major complaint or what is the issue the person is facing, at what time it started, what type of temperature sensation does he feel, whether he feels hot or he feels cold, how is his sleep, how is his appetite, how is his thirst, what is the pain, what type of pain is he feeling, and what is the urinary habit or bowel habit. Everything is being inquired by the traditional Chinese system following doctor. And coming to the palpations, in palpations, they check the pulse types. In TCM, we have around 28 types of pulses, and the doctor individually checks for the pulse to see what type of pulse does the person have. And again, skin temperature as well as acupuncture point sensitivity. Acupuncture is a treatment modality in Chinese system of medicine. Many of you people may already know that because nowadays it is becoming common in Kerala also, and it is it is identified by WHO as a main system of treatment or therapy. So acupuncture point sensitivity is also determined in the diagnosis of TCM. Now coming to the treatment modalities. First one, let's go with acupuncture itself. As you already know, the key or the life force of the body, it flows through the meridians. So each meridians, there are points in which if we insert a needle, they regulate the key flow. So that is acupuncture, and it is used for pain relief as well as inflammation. Next one is moxibustion. The moxibustion name comes from the name Artemisia moxa herb, where it is burned on top of acupuncture points to warm the meridians and expel the cold or stimulate the circulation. Now, next modality is herbal medicine. In herbal medicine, we have plant herbs as well as minerals as well as animal based formulas, which is uh, which is formulated according to the patient's individual needs. That is, no two patients may get same medicine for the same symptoms he is showing. That is how the holistic system of medicine works. Now, coming to the Tui Na massage or the Chinese therapeutic massage, this is also done to stimulate the acupoints and balance the ki as well as for treatment of musculoskeletal disorders. Cupping therapy, or this one is similar to that of hijama therapy in Unani system of medicine, where hot glass cups are placed on the body and the blood is drawn to the surface. It is done to release tension and the inflammation in the body, or the inflammation, as we may say, the pus or the excess fluid in the body comes to that hot area and it gets removed, or the blood circulation improves by cupping therapy. Next one is Tai Chi. Tai Chi is a system as similar to that of yoga, where we have rhythmic breathing as well as rhythmic body movements. This is for the health or health maintenance or the longevity of life. We have coordinated movements as well as controlled breathing and mental focus. Next one is dietary therapy, where the food is classified on their yin and yang energy and based on their element property and prescribed so that the patient gets relief from his disease conditions. And the last one is guanche. Most of the girls may be knowing it is a roller, like guanche roller is available nowadays. It's made up of marble and it's being rolled so that the circulation improves, or it is available as a plate also, straight marble plate, or a or in a shape that is similar to that of an ox scapula. So you people will be similar with that of guanche also. Now coming to the next one is what are the medicines which is used in TCM. So materia medica is where the drugs are catalogued, and the commonly used Chinese herbs, or when we say Chinese herb, the first name which comes to the mind is ephedra or ginseng, which are Chinese medicines. So in case of ginseng, we know root is used. It is used as a adaptogen or a immunity booster. And ephedra, as you know, respiratory conditions or hay fever to be specific. And coming to the next one will be Artemisia moxa, which is used for stop bleeding and all. Coming to cassia or senna, senna is used because of its laxative properties. So most of the drugs, not most, maybe some of the drugs will be similar to you people, or you people will be dealing with that in detail in 5th semester pharmacognosy and phytochemistry too. So just to name a few: Panax ginseng, ephedra, cassia, artemisia, angelica, astragalus. All these are Chinese herbs, or these are abundant in China, and these are abundantly used in traditional Chinese medicine. Coming to the Japanese tradition, it's just a glimpse. This Chinese system is followed in Japan, or it is evolved as Kampo. The name is Kampo, and the name comes from Kan means China and Po means method. So Kampo method. Same, they use the same classical formulas as that of in Chinese medicine. And again, the difference or the core difference is that they give less emphasis on acupuncture and moxibustion, and again they focus on herbal formulas and standardized preparations. Coming to the safety considerations, so uh, evidence-based benefits we may say about the acupuncture is efficiently used for relieving pains in backs, necks and osteoarthritic pain, as well as Tai Chi is used for improving Parkinson's patients because it focuses on coordinated movements or the breathing control. And again, the WHO has included TCM or traditional Chinese acupuncture in global diagnostic compendium, and acupuncture has also said to reduce frequency of tension as well as migraine headaches. But coming to the safety considerations, due to the risk of cardiac risk, ephedra has been used lessly now, and acupuncture with non-sterile needles can lead to infections or organ injury if not done properly. And again, some herbs or like if we use minerals or animals or drugs, it can have contamination with heavy metals or pesticides. And again, the most important thing which I explained during the diagnosis of TCM is that the treatment therapy depends upon the patient who is performing the diagnosis, or it is solely dependent on the practitioner to come with the correct therapy. So it is always important to go to a therapist or a practitioner who is certified and who is efficient enough to do the treatment therapy completely. So I hope traditional Chinese medicine is clear to you people. Just I'll give a go through once again. First, we dealt with the ancient origin as well as history. And the most important thing which we should never forget is Huan Dine Jing, which is the Yellow Emperor's Classic or the Chinese System of Medicine Bible, and the Materia Medica. Li Shinzhen compiled Materia Medica with around 11,000 prescriptions and around 2,000 drugs. Now coming to the theories, yin and yang theory as well as the theory of 5 elements. Then next we dealt with the life force or ki, and again the meridian or the channels. And then we went through the treatment modalities as well as the diagnosis systems used in traditional Chinese medicine. We dealt with around 8 set of treatment modalities and 4 set of diagnosis in TCM, and we went through a list of herbs which are abundant in China, as well as we have dealt with or we have given or we have went through a Kempo, the Japanese system of medicine, which is similar to that of Chinese system of medicine, and the modern perspectives and safety concerns. So I hope TCM or Chinese system of medicine or traditional Chinese medicine is clear to you people. Thank you.